Good morning all. Myself Dr. Ankit Kataria, clinical cardiologist from Spandan Heart Care, Ahmedabad. Let's talk about most common cause of the disability in India is heart failure. Heart failure, simply saying, it is just a failure of the heart to pump blood in an adequate amount to the vital organ of the body. Incidence of the heart failure is rising day by day. In India, it is around 15 to 20 lakhs per year. Heart failure is a very debilitating disease, and early diagnosis and intervention is very much requirement for the quality of the life. Most common cause of the heart disease is coronary artery disease or a heart attack, uncontrolled hypertension, uncontrolled diabetes, disease of the thyroid and kidney disease. Irregular heartbeats and disease of the other organ can lead to the heart failure. Some congenital heart disease or birth defect and valvular heart disease, infection of the heart wall and heart valves are common causes of the heart failure. Symptoms of the heart disease may be vary person to person. Most common being extreme fatigue, rapid heartbeat, swelling of the body or pedal edema, facial puffiness, loss of appetite, breathlessness, shortness of the breath, coughing, especially during night. Frequent micturition is the most common symptoms of the heart failure. Early identification of the symptoms may lead to early diagnosis and early intervention for the better outcome. Diagnosis of the heart failure is very simple and very non-expensive. It can be done by simply doing an echocardiography. You can consult your cardiologist and physician for the early diagnosis. It can be diagnosed by the blood test, ECG and X-ray. Various treatment options are available for the heart failure, including medicines, medical options and surgical options. Medical options being particularly diet, salt restriction, control of the blood pressure, control of the sugar, control of the diabetes and thyroid disease are the primary key to control the primary disease. Whereas surgical options are also available, including along with the medications are ICD implantation, CRTD and heart transplantation are also available for the treatment. Early diagnosis and the treatment of the heart failure is the key for the quality of the life. Strict dietary regime is very much important to control symptoms of the heart failure. Especially salt restriction is must. Avoid junk and oily food. Use plenty of vegetables and fresh fruits. High fiber diet is very much important. Avoid smoking and quit tobacco uses and avoid alcohol use is important. Consult your doctor at the initial symptoms of the heart failure. Early identification and early intervention with proper treatment is a key for the better quality of the life. Take home message is consult your doctor regularly. Go to the doctor at initial of the symptoms. Regular consultation and strict follow-up with regular medication is very much required to prevent the progression of the disease and for the better quality of the life. Thank you very much.